Welcome everyone to our symposium, Evidence-Based Research Practices in Mental Health and Child Development in Rwanda. This is our inaugural research symposium of 2021. And this is a collaboration between the University of Rwanda and the Research Program on Children in Adversity at the Boston College School of Social Work. My name is Teresa Betancourt. I'm Salem Professor in Global Practice at Boston College and also Director of the Research Program on Children and Adversity. So today we'll be focused in the symposium on the importance of child development. As we know, the early years of a child's life are very important for his or her health and well-being, lifelong learning, as well as issues of mental health. And we know that healthy development means that children of all abilities, including those with special healthcare needs, are able to grow up where their social, emotional, and educational needs are met across the life course. And some of the important factors that come into play are issues such as safety, freedom from harm and violence, positive parenting and stimulation, and also topics of health, promotion, nutrition, exercise, and hygiene. So we know from the Lancet series on child development that at that time, and that was an estimate from 2007, it was thought that over 200 million children under the age of 5 years were not fulfilling their full developmental potential. And we see that far too many of children who are categorized in this way of being at risk of underdevelopment are in sub-Saharan Africa. And this means that these are tremendous problems when it comes to thinking about nations moving forward and developing economically and socially. And so today's topic is so important. And we know that for any one child's development and mental health, we have to think about multiple interacting factors. So what we call in child development ontogenetic or individual level child factors, age, gender, temperament, intelligence, genetic history, but also we have to look at what's going on, as Yuri Bronfenbrenner and others termed, in the microsystem. And this is the context of caregiver relationships, attachment relationships, and the interactions between the child and the parent's environment. And then we can't stop there. We also have to think about the mesosystem, the exosystem, extended kinship networks, peer networks, the community, and the other places where children are spending time, including schools, neighborhoods, even the healthcare system. And then we also have to think about the macro system levels, the political context, the historical context, and the role of culture, cultural beliefs about reconciliation, healing when it comes to issues of violence, also topics when it comes to caregiving and parenting, such as gender and the role of mothers and fathers in their interactions with young children and supporting their healthy development. And so the University of Rwanda and Boston College have been in partnership for many years now. We've been working with Dr. Vincent Sezibera since 2007, where we began working on parenting interventions, a family strengthening intervention, which was originally funded by our National Institutes for Mental Health in the United States, that looked at promoting healthy parent-child relationships in the context of families affected by HIV and AIDS. And now we've continued this collaboration and partnership with each subsequent research study, moving not just into areas of mental health, but also looking at parenting in the context of child development, early childhood development, and how could we have an intervention that both promotes early childhood development and prevents violence. And this has been really exciting work, and I hope you'll get to hear about some of that today. In 2020, we received support from the Oak Foundation to launch an additional partnership focused on mutual learning and how together we can talk about capacity sharing and coming together around research on topics that we all have joint interest in, and then being involved in conducting research and also disseminating the results of our research and other related research. So today's conference will bring together researchers, government officials, and community organizations to discuss a wide variety of topics related to promoting evidence-based child development and evidence-based mental health interventions for families and children in Rwanda. We're happy to have an opportunity for early career researchers to present their work and learn from the expertise of today's participating members. So we're really thrilled to kick this off and to have you all with us. I'd just like to thank you on behalf of all of us, and I look forward to a really rich exchange. Murakoze cyane.